Well, good morning, everyone. Thank you for taking time out of your day to join us for the webinar this morning. My name is Matthew Klamer, and I'm a National Sales and Marketing Director here at MAS. I'd also like to introduce MAS to you. We are a nationally recognized award-winning field marketing organization and a leader in the insurance brokerage industry. Our office is located in beautiful Hoover, Alabama, just outside of Birmingham. We're excited to share with you that MAS became a partner of Integrity Marketing Group in October of 2019. We've had a long-standing relationship with Integrity Marketing Group over the years, so it was a natural alignment for us to become a platform partner. Through this, MAS will bring more products, more tools, and more resources to our broker distribution. We are truly honored to be working alongside other partners in our industry. Integrity isn't just on the cutting edge of insurance technology, it's leading the way. Developed by world-class experts, our proprietary tools, resources, and exclusive services help customize the insurance experience so consumers can find the right coverage and be prepared for the good days ahead. At MAS, we're proud of the superior service, support, and training we provide to the agents across the country who work with us. We take great pride in our relationships with our agents and carriers. Our staff provides marketing strategies and assistance, creating numerous opportunities for our agents through lead programs, our Turning 65 platform, the Agency Builder program, Fast Start Incentive, and other incentive programs as well. MAS marketing managers and directors are eager to work with producers to help you grow your business. We can provide a market analysis of products available in your area to help assist you in developing a strategic marketing plan for your business. We're always up to date on the latest products, carriers, lead programs, and services as they become available. Of course, we're always available to provide both back office support and field support, making it easier for you to concentrate on sales growth. Our goal here at MAS is to help you grow your business. Our specialty is the senior market, and our carrier portfolio is supported by Medicare supplements, prescription drug plans, Medicare Advantage, final expense, whole, term, and universal life, and annuities. We also have hospital indemnity, critical illness, cancer plans, and dental, vision, and hearing products we work with as well. Here's just a short look at some of the products that are in our portfolio. At MAS, we have exclusive lead programs, so direct agents with 3 or more active carriers receive a discount on their first lead mailing. Our co-op program is available for consistently producing agents. Get 7 issued apps in a month, we'll give you a 25% discount on a mailing. With 12 issued apps in a month, it's a 50% discount on a mailing. And if you get 20 issued apps in a month, we'll do a 100% discount, so a free lead order for you. Lead co-op is also available to agencies with downline hierarchy, so just give us a call and ask about our cost-sharing opportunities. Check out the new Medicare Center. It is a one-stop shop for everything you need to successfully navigate the sales and enrollment process. You can now experience Medicare Center with the full power of CSG's resources: e-apps, data analysis, quoting tools, competitive analysis, and an exclusive website plugin to capture Medicare supplement leads. This tool will literally put you on the cutting edge of technology, offering you the ability to run quotes for Medicare supplement plans, run quotes for Medicare Advantage, compare products side by side, download current applications and outlines of coverage for desired plans, as well as email applications and outlines of coverage directly to your clients. All agents who wish to use the tool need to register for a username and password for our website and must be contracted with MAS for select Medicare products. We have a T65 locator tool available as well. The T65 locator makes it easy to find local Medicare prospects. It's quick to use and pulling up locations on the map is a breeze. The best part, it's free for agents who do business with Medicare Advantage specialists. We all know that growing your business is only going to happen if you develop a winning strategy, consistently put in the work, and utilize smart tools and platforms that make it easier for you to deliver your expertise to the right clients. That's why we developed a T65 workshop platform. We assist our agents in identifying target markets for the turning 65 population. We created a process that is so simple for agents to follow that we now have so many agents hosting weekly and monthly meetings, creating a tremendous stream of lead generation. Talk with one of our marketing directors today to learn more. We also offer an agency builder program, and it is just that. Let us help you build your agency. If you're interested in recruiting agents to grow your agency, we can provide recruitment lists provided along with our auto dialer capability. We can generate special call campaigns created just for you, as well as offer our co-op opportunities available for lead programs. For new agents only, we have our Fast Start bonus. You will receive a $25 Visa gift card for your first issued app, and if you can get 4 more issued apps in the same month, you'll receive an additional $75 gift card. We also offer an agent referral bonus that is available to you. If you refer an agent to Medicare Advantage specialist and they write their first app, you will get a $50 Visa gift card to show our appreciation. Now, this does not apply to Medicare Advantage or dental production. Prospecting can be a challenge, but we are helping to arm you with the tools necessary to help you be successful. We understand that our long-term success will define itself based on your success as an agent or a carrier. Medicare Advantage Specialist is committed to exceeding our clients' expectations in every interaction and helping you achieve that same level of service with your clients. Agent support is our primary goal. We provide every tool we can to identify to assist you in your efforts to identify, inform, close, and follow your sales process. In practical terms, our marketing team works arm in arm with you to deliver print media, internet, direct mail, and other marketing tools, keeping your pipeline moving. We have one of the most experienced support teams in our industry. When you work with us, you don't need to buy T65 lists anymore. Plus, you get access to the Medicare Center, free marketing customization, our quoting tools, and so much more. So here's how you can contact us to discuss any of the topics from today. And you may be asking yourself, what now? Well, we are here busy strategizing for the SEP and planning for SEP sales. Be sure to outreach to your marketer, as we've got some great data put together with the 2022 landscape, as well as tons of marketing ideas. And with that being said, now let's get to today's webinar subject. With us today, we have Rodney Raines, our National Sales Director for UnitedHealthcare. Rodney has had a long relationship with MAS, and we are proud to have him here with us today. Rodney, I'm going to hand it over to you.
Okay, thank you. I appreciate it very much. Let's see, looks like you just sent me I just need to click here to show my screen. Let's see if we can make that happen. Can you hear me and can you see the screen okay?
Yes, sir. I hear you and I can see just fine.
All right, perfect. Well, certainly thank you, Matt, for having us on board here. We appreciate the opportunity to talk a little bit about 5-star plans, in particular with UHC. So thank you, MAS, for giving us that opportunity. And I certainly want to thank all of the agents out there that are joining us this morning. We appreciate your taking the time to learn a little bit more about 5-star opportunities and why 5-star plans are important. You know, we talk about, we know the value to the member, or we probably understand the value to the member, but there is value in the 5-star plan for everyone, particularly for the carriers, obviously, UnitedHealthcare, as well as others. Note that this is the star rating, which we'll get into some of the details here, but I'm sure you understand that this is not particular to UnitedHealthcare. This is all Medicare Advantage carriers have the same rating system. So We will talk specifically about UnitedHealthcare at certain points of the presentation, but a lot of it is just about the 5-star opportunity and some of the components there. But again, as Matt mentioned, my name is Rodney Raines. I'm a National Sales Director, and I work directly with MAS in their support of for UnitedHealthcare. So getting into the basics here. So 5-star plan. So at UnitedHealthcare, as well as you'll find, I'm sure, the other carriers, we're very committed to delivering the clinical quality, access to care, and a distinctive positive experience for the members that we're privileged to serve. Star ratings are a very integral part of that, and we'll talk a little bit more as we go about the funding and how that works. But star ratings are vastly important. We're always striving to reach that 5-star level, and we'll talk in a little bit about how the star ratings, the funding improves as you increase your star ratings. But I did think it was important to note that approximately 2.8 million of our current Medicare Advantage members are currently in a 5-star plan for the 2022 star rating period. So that is certainly more than any other carrier, and it represents nearly 38% of our total membership. Of course, that the 5-star rating, which we're talking about, is of course CMS's highest star rating, which we'll get into the details in just a moment. So talk about the focus, a little bit of an outline of what we're going to talk about. We're going to talk about star ratings. We're going to talk about plans, how they're measured, and how the stars are earned. We're going to talk about the components of the 5-star special election period, which is certainly valuable to you then that you can market this year round, including we're going to talk about the plan, who is eligible, and how you actually perform the enrollment, and a little bit about finding consumers. Talk a little bit about resources that are available to you through the UnitedHealthcare Toolkit, through Jarvis, and some marketing highlights. And then we'll also talk about what we can do to preserve the 5-star rating, what you can do to help. And you'll notice a lot of, I'll mention it throughout the presentation, but we really work this together so far as the carriers and the agents, because you guys are the front line for representing UnitedHealthcare. You're in many cases the face of UnitedHealthcare. So your presentation and the things that you do to support your members weigh extremely heavily into these rating measures. And so we truly are partners when we talk about things that we can do to deliver a 5-star rating. So the star ratings. Center for Medicare and Medicaid Services, CMS, rate the quality of Medicare Advantage plans, which of course we call Part C, Medicare Advantage. That includes the D-SNP plans, even I-SNP, C-SNPs, all are included there, as well as prescription drug plans. And the rating system is based on 5 stars. So you can think it a little bit about a little bit like a 5-star hotel, right? If you've got an option between a 5-star hotel and a 2-star hotel, where are you going to stay? More times than not, I'm going to choose the 5-star hotel because of its quality, and it has earned the rating to be there. It's a huge impact and vastly helps the beneficiaries evaluate all carriers based on a very similar process and a very similar rating system. So, we still have to do the needs process and evaluate the providers and the prescription drugs, and of course the benefits weigh heavily. But if you consider things to all be similar, all things being equal, the star ratings give the members a very good way to determine which plan has the best ratings. You can see all of this on Medicare.gov. We'll talk about a little bit more about that in a moment. Again, this is not unique. This is across the board. So how star ratings are determined. Contracts are rated on a scale of 1 to 5, again, rounded to the nearest half a star. So you can have a 4.5-star plan or a 3.5-star plan. There's 38 measures that go into determining those star ratings. Everything from preventive care, member surveys, customer service, prescription drug monitoring, among other quality care metrics. So we hear a lot about medication adherence, that being a big part of the prescription drug monitoring. And then, of course, again, right there, the member surveys and customer service. We all play a role in that. We all play a role in how that member is involved and enrolled into the plan. It's typically the agent, of course. And then the service level, we all have to provide the customer service from the agent through the carriers. These performance are measures measured by a system which they are calculated can change from year to year. So star ratings, of course, you're probably aware they always come at about the first or second week of October. So right as we're getting AEP started, we get new star measures or new star ratings, and oftentimes we have to insert the new star ratings into the booklets. Just because that's when they come out for the following year. So the 2022 star ratings came out the first or second week of October in AEP of 2021, or writing AEP business for 1/1/22 effectives. So on the right-hand side, you see a little pie chart, and you see how the different quality metrics factor in. So 33%, so 1/3 of the measurement is based on clinical measures. So this is also referred to as HEDIS, but basically the clinical care, the outcome of care, how are the members being taken care of. The next biggest piece of that full pie is the 33% for member satisfaction. So member satisfaction measures the surveys, the customer service. 1/3 goes into that, again, where we're extremely closely related partners in delivering that 33%. So between the clinical measures and the member satisfaction measure, that represents 2/3 of the star ratings. Then you've got 15% for operational measures. You've got 15% for pharmacy management measures, talked about the drug adherence and the prescription drug monitoring, that sort of thing, and then another 4% for CMS reporting measures. Let's see, so focus on quality improvement. UnitedHealthcare remains focused on 3 key areas. Sorry, I'm having a little difficulty with my, there we go. Okay, drive better health through access to effective care and clinical quality engagement. So that's the clinical piece there. Operations, exceptional performance for health plan operations through appeals, timeliness, fairness, and lower complaints. And then we've got satisfaction. Offer great service to improve member satisfaction. Pretty straightforward there. 3 key areas that we focus on. So I mentioned that we focus, or we talk a little bit about Medicare.gov. I think it's important that you utilize Medicare.gov to get familiar with the star ratings of the plans in your area. Important to note that star ratings must be disclosed out loud, and you must indicate where in the enrollment guide those star ratings can be found. Anyone can view the star ratings, as you see here, through Medicare.gov. Any member, any agent can take a look at these and look at the comparisons. But of course, as an agent, you must be credentialed to represent a plan or to present a plan once you find the best plan. So if a random plan that you're not overly familiar with or that you're not contracted with shows up as the top plan, you'll need to make sure that you're contracted to sell that plan. So here's a comparison that you can utilize in Medicare.gov to compare an overview of a couple of plans. You'll see on the left-hand side that the star rating clearly represents this plan's got Medicare's highest rating of 5 stars. And then on the right-hand side, you see a 4.5-star plan. And you'll notice everything else under a 5-star is represented in this manner, where the stars are shaded to the half a star. So this one on the right-hand side is a 4.5-star plan. And then again, some more of the comparisons there between the plans as far as benefits go. Okay, so now let's talk about the SEP. So the 5-star SEP and the corresponding PDP 5-star SEP that will go along with an SEP for a Medicare Advantage plan, if in fact there happens to be an MA only plan. So CMS has established a SEP that enables consumers to enroll in a 5-star plan anytime from December 8th, 2021 through November, this actually says 11th, my apologies. It's actually November 30th through the month of November up to a December 1 effective of 2022. So an individual using this SEP can enroll in an MA only or a MAPD plan, even if coming from original Medicare. So they don't have to be switching from a Medicare Advantage plan, even if they're on original Medicare and didn't make a selection at their initial opportunity. They can roll into a 5-star plan anytime, again, during December 8th through November 30th. We will discuss particular plans, UHC plans, a little later in this presentation. And I mentioned already that, that if you happen to enroll into an MA only plan, there is a second SEP that occurs that will allow a member to enroll into a PDP plan. And that, in this particular case, the PDP plan does not have to be a 5-star plan. So if you use a 5-star enrollment into, say, an MA only plan, if that's available in your market, then the PDP option that may come available, or that does come available, but that may be desired, goes along with that, and it does not have to be a 5-star plan. It could be any star level, and of course, this would include all UnitedHealthcare plans. So for example, if Barbara resides in a county where there is a 5-star plan available from UnitedHealthcare, for the 2022 year, Barbara can enroll enroll a member into the 5-star plan and can submit an application for the plan using the 5-star SEP anytime, again, December 8th to November 30th, for the next available effective date for the 2022 plan year. So I'm pulling a little bit of information from the election period booklet. I'm just pointing out where that is in the UnitedHealthcare Jarvis under the training, but I'm going to show it to you as it's written in the handbook here. So this is the particular guidelines for the 5-star SEP. You'll notice on the left-hand side, the population is anyone enrolling, anyone that qualifies for a Medicare Advantage plan with 5-star SEP, which is basically anyone that resides in those counties, right, where the plan service area exists, have the opportunity for one election. There in the middle, the time frame, one election for an effective date within the plan contract year, and that date would be the first day of the month following the receipt of the election. So again, number allowed, number of election periods allowed, one election, again from 12/28 to November 30th, can enroll into the 5-star plan. When you're doing the coding, the code is SEP. The reason, you just simply put 5-star and you're covered. So here's the corresponding PDP example. I won't walk through all of it, but again, it's basically, this is generated when you utilize a 5-star SEP enrollment for an MA plan. Same opportunity, same qualifications, same time frame, same number of elections. And then for the application coding, you would simply put corresponding PDP 5-star. So that would be if you're enrolling someone into an MA only plan or a PFS plan that did not have drug coverage, you've got the corresponding 5-star election. If you're using the Lean platform for UnitedHealthcare, you'll notice there that the 5-star written out is the selection that you would utilize for that reason code. Okay, now we're going to talk a little bit about funding. So I mentioned earlier that the funding is on a bit of a sliding scale based on the star ratings that the plan receives. So the higher the star ratings, the higher the funding. So obviously a five-star plan is going to have the highest funding, receive the highest funding for each Medicare beneficiary that enrolls into that plan. Basically call that the quality bonus. And of course, it's vitally important for a number of measures. First and foremost, it helps us improve the benefits for a member. So as the star ratings increase, we get more funding. So we're able to put more dollars into that plan to improve the benefits. Many people look at benefits. You'll notice at UnitedHealthcare, we put a lot of those dollars and a lot of the attention into the service aspect of it, the member service. So that being a huge part of the 5-star rating and vitally important for the member satisfaction. So we can put more dollars into service and also to support the agents. It gives us the opportunity to put more dollars into marketing as well, right? So funding is vitally important for those 3 reasons. Everything that all of us do every day impact the future of those payments, and it's critical to maintain those star ratings once we achieve the higher star rating level. So vastly important, and that's again emphasizes the partnership between the carrier, the agents, and the agencies. We all have to do our part to deliver those higher star ratings and to receive that higher funding for the carrier. Benefits everyone across the board. So let's talk about the 5-star components. So first off, who? So any Medicare consumers who live in the service area with a 5-star plan. Again, I mentioned earlier, they still have to do a needs assessment. The 5-star is not the only thing that we're going to look at. But if the medications fit and the providers fit, the 5-star plan is a very good indicator, or the 5-star rating is a very good indicator of that plan's performance, both clinically and providing satisfaction to the member. So what? Enroll in a 5-star plan. Straightforward on that one, right? When? We already mentioned it. Can't open it or stress it enough, but it's basically all year, December 8th to November 30th. And of course, after November 30th, those few days that aren't included, you've got the AEP for a 1/1 effective. So it's really truly a year-round opportunity for you. Again, one election. Why would people do that? Of course, we know many folks become unhappy with their current plan. Maybe the plan's not meeting their needs. Maybe their medication needs have changed, provider needs have changed, what have you. It gives there's a million reasons why someone could want to change. Sometimes people just change for spite, right? Sometimes people just change because they don't like something that happened to them, and they just want a new plan. I know I've done similar things. So again, I mentioned it can also be original Medicare that did not choose an MA plan during their open enrollment period. They can also utilize the 5-star election period. So now let's talk a little bit about the available plans within UnitedHealthcare, 5-star plans within UnitedHealthcare. So here are all of our contracts, and these are all of the contracts in the states that they're located in. I'm going to show you a map in a moment. Important to know a couple of things. The third one down, the H0710, that is actually an ISNP that we can't sell as broker agents. We have a dedicated sales force for that particular plan. So if you're looking there and seeing all of those states, those states we typically can't write in. Again, that's an ISNP plan. And then down at the very bottom, the 5652, that is an Erickson special needs plan that also broker agents, even captive agents, can't sell either one of those plans. So But the rest of them, we'll put them on a map here for you. We do have the ability to sell. So here is the 5-star footprint. Wholly, meaning all plans, non-SNP and D-SNP. Here are where all of our 5-star opportunities exist. Okay. Here is particularly non-SNP, just a little bit different. We do have some non-SNP that's available in some areas where we don't have D-SNP. And then here is a shot at where the D-SNP 5-star opportunity exists. So you'll notice the D-SNP is quite a bit less geography that's included. And of course, you can imagine by the conversation that we've had that the D-SNP is quite a bit more difficult to obtain the ratings just by the nature and behaviors of a typical D-SNP member. A lot of times they're not getting out to see the doctors as they should. A lot of times they're not getting their prescriptions filled as they should, and some different things. Just the overall dynamics does make it a little more difficult to achieve that 5-star rating with the D-SNP member, but still have some significant opportunity there. You'll see the whole state of Louisiana. So here's some, I wanted to show you a view also of where the 5-star plans were selling. So these are by market. So like if you look, the Dallas market is the top selling market for 5-star plans. No surprise that it's also one of our top selling markets, or our #1 selling market for all MA. But this kind of shows you a list by business market where those plans are selling the best. So Texas, Dallas, San Antonio, then you see Charlotte, Milwaukee, on down the list. Those are our top selling markets. You see quite a few in Tennessee, quite a few in Virginia, Ohio, Wisconsin represented again there, Detroit, Michigan. And then I mentioned a couple in North Carolina, both Charlotte, Piedmont, and the Asheville market all have top selling 5-star plans. Here are the rest of the 5-star plans, again, by business market. These are your lesser sellers. You'll notice a lot of them are smaller markets, so it kind of fits. But the 5-star opportunity is going to present good sales in any business market that they're in, as long as, of course, the network is there. Okay, so 5-star SEP strategy. Start with a plan, right? So the first thing that we should look at is the AEP pipeline, right? Members that maybe you didn't enroll, but that you still have permission to contact. That's going to be a #1 source of opportunity for the 5-star SEP. It's important to think about who will benefit, and you know, as we've conversed a little bit today, of course, it can be any Medicare recipient. If the plan meets the needs assessment, it can be any Medicare beneficiary out there that again lives in the service area. So much of the marketing is going to be the same, right? We're going to continue to do community events, local community meetings, retail venues, enrollment centers. Basically, if you are working the Medicare Advantage business in a market that has a 5-star election period, you can basically market like you're in AEP all year long. So all of those different venues, any way that you would provide, any way that you would do your marketing, including, of course, the providers and pharmacies that are in your markets in those 5-star areas, service areas. So resources, things to help you do that. Hopefully many of you are familiar with the UnitedHealthcare Toolkit. This is available through Jarvis and gives you a host of information that's available for you specific to 5-star Medicare Advantage plans. Your marketing material does not have to be specifically geared toward 5-star, Any of the marketing that you find available for the plans would be available, but there are specific opportunities or specific marketing pieces that highlight the 5-star opportunity. A broad range of materials, both in English and in Spanish, is available to include flyers, letters, signage, postcards, things of the like. Here's a look at a letter, some of the banners, the pull-up banners and stuff like that that would be available for you in a community environment where you're marketing to a public environment. Get you noticed, right? So I mentioned early on 5-star ratings. How do we maintain those ratings and how important it is? And again, you know, much of this is the partnership between you and the carrier, the agents and the carrier, and again, of course, the agencies. We all play a vital role in that. We all play a big role in providing better care, right? Important that you encourage your members to take advantage of the opportunities that are out there, the benefits that are provided, the annual screenings, the preventive measures, preventive care, encouraging them to do their visits. All of those things are going to increase the health outcomes, improve the health outcomes. Again, vitally important to maintaining those ratings and just providing an overall better experience. Conversations that you have with the members include, again, I kind of mentioned this in the previous slide, but you know, encouraging your members to take advantage of the benefits that are available through the plan. Many types of annual screenings, depending on the member's health, are available out there. Again, encouraging them to go to the doctors, encouraging them to stick with their Medicare or their medication, right? Maybe help them get set up through Optum and make sure they understand the mail order benefits. If they're not likely to leave their home, we can get the medication delivered straight to their doorstep. So we will play a vital role in that. And of course, as the agent, you do as well. Talk about house calls. House calls covers, gosh, I want to say it's like 28 of those 36 metrics that we're able to check off a lot of boxes with house calls. So encourage your members to take advantage of the house calls plan or program where they exist, and most of our plans has that opportunity. So again, something that you can help us and encourage. Of course, we're going to reach out and try to get those done ourselves because we get so much data, so much information, and check off so many boxes with the house calls. So good opportunity for it. So also member rewards. After you do an enrollment, we can't talk about member rewards to entice a member to enroll, but talk about the rewards that are out there for members when they do some of their annual maintenance type of things, their physicals, the wellness visits, the house calls visits. You know, the numbers may change and may vary slightly by plan, but in most cases we'll send a $10 or $15 Visa card as a reward to a member for performing some of their wellness requirements. And again, what's in it for you? Higher funding, more competitive plans, and more marketing dollars. So it's a win-win for everyone out there. And I'll kind of finish things up here by talking a little bit about the 6 key enrollment conversations. So I've talked a little bit about some of them, but you know, the most important thing when you're enrolling a member, of course, is the coverage. Talking about the network fit, are the providers within the network, and then the drug coverage. Are there prescriptions? Are there medications covered? So you know, it's important that we always be sure that we cover these things, because if we don't, it's going to negatively impact our star ratings. So care, talk about the member resources, things that are available to the member, and talk about, again, those health and wellness opportunities to get the members engaged with their plans and utilizing the benefits of their plans. And then I would always discuss the convenience of the plans. You know, the house calls where we have a nurse practitioner come into the home and at the convenience, the member doesn't even have to leave the home, and we can do a lot of things with a house call visits from a clinical standpoint. A lot of times, a lot of times we identify things that a member may never experience. It saves lives, folks. House calls truly saves lives, and that, you know, if we identify something that a member's putting off a trip to the doctor over and just doesn't think it's a big deal, there have been so many clinical stories where we uncover something at those visits, and you know, the member could have had a catastrophic event at any time, just a ticking time bomb. So promote the convenience of the house calls, and then promote the convenience of the Optum home delivery, getting home delivery of the medications. Again, convenience, and we're able to check off that box for medication adherence. So that's it for my five-star presentation. Tried to keep it somewhat brief and give you some of the details and some of the UnitedHealthcare specifics. Hopefully we've been able to accomplish that. Are there any questions? Matt, we want to open
Rodney,
it up?
I had one question in chat that I went ahead and answered while you were presenting, which no other questions. Tells me you did a great job, my friend. We really appreciate it.
Okay. Well, again, I will wrap things up then. And again, thank you, Matt and MAS, for having us on board. And again, certainly appreciate all of you for attending and taking the time out of your day this morning.
Yes, thank you as well, Rodney. If anyone does have any questions, please feel free to contact us at our office. And again, like Rodney said, we'll give you the rest of your day back. Thanks, everyone. Have a great day.